My name is Valerie Reynolds, and I do public affairs and marketing for a nonprofit organization in the Chicagoland area. I'm a single mother of a 3.5-month-old little girl. Prior to having a child, I never really had issues with the health insurance because I paid into my premium. I went to see the doctor once or twice a year. Sometimes I had a copay, sometimes I didn't, even though I hated the copay because I was paying into a premium, all year. But I went into the hospital for the first time in my life when I had a child, and now I have an exorbitant bill that I can barely afford. And this is despite the fact that I've been healthy. I've always been really diligent about my preventive care. And now that I've had a life transition, I had a baby, it's like the healthcare industry is punishing me and making me pay more money than I should be paying because it should be already included in what I've been paying into for the last 2 or 3 years. Health reform to me would mean really it would mean comfort. It would mean having extra money to save perhaps or to spend on my child instead of giving it to the hospital and the healthcare industry. Right now it's just an amount that I can't afford it at all. I can't afford to. When I look at the bill, it just kind of stresses me out because I know in several months it may end up on my credit report. But at this point, with a new child and a new daycare expense, it's just something that I really can't afford. I'm just really frustrated with the current system, the current healthcare system, just because, as I said, I've never been hospitalized before. I've been paying into a premium. I'm 31, almost 32 years old. I've been working since I was working full-time with the healthcare benefit package since I was 18 years old. And even though it has been separate, it hasn't been one job. It has been going off to the healthcare industry. And it's probably thousands of dollars amongst thousands of dollars, and now here I am paying again thousands of dollars into a system that I've already given a lot of money. So it's just really frustrating to know that this vicious cycle will continue anytime I need health care.
We live in Chicago, on the Northwest Side, and we have 4 children, ages 19, 16, 13, and 11. I have a real estate business, Real Estate Broker Associates.
I was a union carpenter, so we had union insurance, through the Carpenters Union for 20 some years, which is really good insurance. It covers vision and dental as well as good coverage with medical, so we had no worries about insurance for years, up until I resigned from the union maybe 3 or 4 years ago, and I had my own business, so I needed to find insurance on my own. We started, once I had resigned from the union, we had Cobra to start with, and that was maybe, I think, $1,100 a month. When Cobra ended, I had to find new insurance, and then found out that I have psoriasis, so I was uninsurable. So I ended up getting insurance through the state ICHIP, Illinois Comprehensive Health Insurance Plan, and that costs about $700 a month. Cynthia and the family just have their own insurance, and that's $500 a month. So we pay about $1,200 a month for health insurance. My deductibles with ICHIP is about $2,100, and I think the families is about $1,200.
No, I think mine is $2,200. That's what I have to get to before my stuff starts getting paid. The main thing is that we don't have the vision or the dental, so I haven't gone to the optometrist with them this year, maybe even for 2 years. We don't do the wellness checks as much. Like we did with carpenters, even the dental cleaning, like that was covered. So we went every year, all of us went twice a year. And then for the wellness checkups, I went every year with the kids and myself. We don't do that as much unless there's like a physical they need for school, or if there's something they need through sports.
I take a drug once a week for my psoriasis, and that shot it costs about $400 each week. So for me to keep taking that drug, I basically have to have insurance, or I couldn't afford it.
But what if we can't afford the premiums? I mean, you figure what, that we would always, how would we pay?
We haven't gotten there yet. I mean, hopefully it doesn't come to that, but if it does, I'm not sure what I'd do if it came to that.
I'm Stephen Starr. I'm principal of a small graphic design firm called Stephen B. Starr Design. The trouble came for me when I began to try to find insurance after my COBRA expired. This was in 1991, and I had two things which seemed to be strikes against me with every insurance carrier that I contacted. One was that HIV/AIDS seemed to be a big issue for many insurance carriers at that time, and they seemed to be able to flag what they considered single gay men, and I'm in that category. So every insurance carrier that I talked to was very careful around this issue, and I think I took 3 blood tests with potential insurance carriers without, and then later was rejected, even though I'm not a carrier of HIV/AIDS. I found that very distressing and rather disruptive and kind of disrespectful. The second strike I had against me was that in 1989 I was in a trauma recovery center for a month, just over a month. And that was also a red flag for absolutely every insurance carrier that interviewed me. They didn't want to touch me. My privacy was really invaded in terms of being interviewed by the insurance carrier around what was the nature of my trauma, what was involved in this trauma recovery center, and I found that a very unpleasant experience. I think our healthcare system is broken. I'm happy to say that I do carry private health insurance for myself now. I think I pay a good premium for it. My premium goes up every year. I have a very high deductible. I consider $2,000 a high deductible. My health insurance I would call catastrophic. Doesn't carry any routine or preventative benefits to it. I'm glad to have it. If there were, a catastrophe, a healthcare catastrophe for me, I would be covered and cared for. But on a practical basis, there's no incentive for me to go and seek out preventive health care. I pay cash for all of that.